We all tend to think of sleep as our body's time to just shut down and rest. But what if I told you that for your heart, the night can be one of its most active and maybe even one of its riskiest times? So today, we're going to pull back the curtain on the secret life of your heart after the lights go out. And that really sets up the big question, right? When you close your eyes at night, is your heart truly getting a break, or is it actually entering its most vulnerable hours? And the answer? Well, it's pretty surprising. Turns out it's kind of both. So what we're really talking about here is something called a sleep-related cardiac arrhythmia. In plain English, it's just an abnormal heartbeat that happens or gets a lot worse while you're asleep. And look, this can be totally harmless, a complete non-issue, or it could be a sign of something way more serious. Okay, so to get why this happens, you first have to understand that sleep isn't just one big monolithic block of time. It's got these two really different faces, and each one has a completely different effect on how your heart behaves. First up, you've got your deep, non-REM sleep. This is when your rest and digest system is in charge. Your heart rate slows way down, the rhythm gets nice and steady, and your blood pressure drops. Everything is calm. But then you hit REM sleep, your dream state, and whoa, the whole game changes. Your fight or flight system suddenly takes the wheel. Your heart rate gets all variable and fast. It's like flipping a switch from calm to chaos, all while you're totally asleep. So who's in charge of all this back and forth? It's your autonomic nervous system. Just think of it like your body's automatic pilot running everything in the background. And this right here, this is the key, this constant dramatic shift between the rest and digest mode and the fight or flight mode is exactly what can create the electrical instability that might set off an arrhythmia. All right, so we've got the baseline for what's supposed to happen during the night. Now let's talk about what happens when the beat, well, when it goes wrong, and look at the different kinds of arrhythmias that can pop up during this nightly drama. You can basically break them down into three main categories. First, think of the turtle. These are bradyarrhythmias, where the heart just gets abnormally slow. Sometimes it's a sinus pause, where the heart's own pacemaker just takes an extra long break. Then you've got the rabbit, tachyarrhythmias. This is when the heart beats way too fast, and it's usually sparked by those chaotic surges in REM sleep. And finally, there are ectopic beats. Think of these as little electrical hiccups. An extra beat here, a skipped beat there. Super common and usually totally fine unless they start happening constantly. Okay, but here comes the big reveal. Because while all this natural shifting during sleep can cause some issues, there is one single condition that just pours gasoline on the fire. It is, without a doubt, the most important piece of this whole puzzle. And that condition? It's obstructive sleep apnea, or OSA. Honestly, this is the absolute game changer. When we talk about serious, dangerous arrhythmias that happen during sleep, the conversation almost always has to involve sleep apnea. So what's actually happening here? Well, it's this crazy, powerful chain reaction. First, the airway closes up and the person stops breathing. That makes their blood oxygen levels crash. The body, of course, panics. It hits the fight or flight alarm button, sending a huge surge of adrenaline to wake the person up just enough to take a breath. And it's that violent, sudden jolt of stress that creates the absolute perfect storm for an arrhythmia. And get this can happen hundreds of times, every single night. And when that happens night after night, the results are, well, they're pretty clear. People with sleep apnea are at a much higher risk for really serious things like atrial fibrillation, or AFib, which is a chaotic rhythm that dramatically increases the risk of stroke. They also get those long, scary pauses in their heartbeat. And they have this classic wild swing. Their heart rate gets super slow while they're not breathing, and then bam, it goes into overdrive the second they gasp for air. Okay, so that all sounds pretty scary, right? But here's the good news. Once we know what's going on, we have really effective ways to find it and to treat it. So let's dive into how doctors actually figure this out and what they can do about it. So, the gold standard, the best way to diagnose this is with an overnight sleep study.